afternoon, everybody. Can everybody hear me okay?
Yeah.
Good, that's usually not my problem, being heard. Thanks for coming out today and sharing your time with me. I really appreciate being here. So what we're going to talk about today is what we all want, is we want to prepare for the easy life. I guess I should have done a little sooner, huh? Tough, right? There we go, preparing for the easy life. Good. So why am I up here talking to you about this? I have been in the employee benefits and health insurance field for 26 years. It'll be 27 in January, so I've literally been doing this for more than half of my life. I believe very firmly in continuing education, so I've earned a bunch of different certifications and designations over the years. I am a chartered benefit consultant, I'm a registered employee benefit consultant, I'm a registered health underwriter. I was one of the first 6 people in Arizona nationally certified in the implementation of the PPACA, which is sometimes called Obamacare, sometimes called the Affordable Care Act, however you feel about it. I use the real acronym, so PPACA, that's what I'm talking about. And I have been very active since I started this agency in 2009. My focus, even though in the past I've worked with all size groups and even with states and municipalities, since 2009 I've focused on working with small business owners and their employees, individuals and families, and people with Medicare. So I've spent a lot of time helping people as they're transitioning into their retirement from their working years. So that's what I'm going to talk about today, because this is what we all want. We all want to live the easy life. At some point, and for each of us in this room, I'm sure it's a different number in our head of when we're going to retire, but we want to make sure that when we do retire, we can retire comfortably and that we're prepared. So what I'm going to talk about today are 3 things, 3 pitfalls, very, very common mistakes or bad things that happen to people when they're preparing for that retirement. And I'm going to use real life examples of people that I've worked with to kind of demonstrate the big idea, which pitfall number 1 is waiting till the last minute to look into Medicare or look into health plan pricing and availability if you're younger than 65 and aren't eligible for Medicare yet. It's really, really important to plan ahead before you retire. And so I've got a little cautionary tale about a woman I worked with this summer. She called me, she was referred to me by her financial advisor. She's 64 years old. She decided in a very short time frame to retire. She called me the 2nd week in August. She had already given her notice. Her last day was going to be like the 29th. She needed health insurance coverage starting on September 1st. Had not even looked even the tiniest bit into what insurance would cost her or what she was going to do until she turned 65. And when she was working, had been paying $100 a month for her health insurance. So when she called me, she said, I'd like to get a plan where I can continue paying about $100 a month. And as you can imagine, those plans don't exist anymore. So there were 3 things we had to deal with her, and the first one was timing. Well, now, since the PPACA passed, individuals have been pushed into annual decisions about health insurance. So if you're a person buying on your own for yourself or your family, there's one time a year that you can go to any other plan you want to go to. And in the middle of the year, you need to stay where you are unless you have an IRS-approved life-changing event that gives you a special enrollment reason, which she had, because losing her group coverage was that special reason for her. So that we had the first obstacle overcome. The second obstacle, though, was timing. Again, because of changes in the law, it used to be if you wanted coverage September 1st, you could apply August 31st. It's not that way anymore. Most carriers, you've got to apply before August 15th. And if you don't, you've missed your window for that month and you have to delay your coverage effective date. So she had to make a decision. She called me the 2nd week of August. She had to make a decision really, really fast. And the third obstacle we had to overcome with her was cost. We talked about the $100 a month. Well, this year in 2014, for an individual looking for coverage, a 64-year-old, there's about 102 plan choices out there from 6 different good carriers. The prices for her ranged from $398 a month, that was the very cheapest health insurance plan, qualified health insurance plan she could get, and it's not a good plan, up to the very most expensive plan she could get was $948 a month. So that's the swing now. When people talked about or heard about Obamacare on the media, they heard a plan, the Obamacare plan. Well, there is no Obamacare plan. There's just a couple thousand pages of new rules. And so when you're looking for a plan, more than 100 choices and premiums that can be triple the cost at the top end. So what happened with this lady was not a good results. She couldn't afford any of those plans, and although I'm hoping to talk to her again during the open enrollment period for next year, she is currently sitting uninsured because she didn't plan ahead. And one of the things I may have forgotten to mention earlier, when I asked her why she was doing this so quickly, she said, "I just couldn't stand working here anymore." Okay? Which is a common feeling for some people if they're in a job they don't like, but it is something you have to try to overcome when you're planning ahead, because it's important not to do things too hastily. Pitfall number 2. Now we're going to talk about somebody who actually is over the age of 65 and is retiring from a very successful career. I had a gentleman call me this summer. He had originally called me in 2012. So he started planning real early, about what he was going to do. And I still had notes in my system for the conversation we had. So when he called me this summer, he had actually apparently not paid attention to what we talked about in 2012. Because one of the first things I always say is if you're thinking about retiring, again, you have to plan ahead. The very first thing you need to do is contact Medicare. Find out what your Medicare Part B premium is going to be, okay? And the pitfall here is thinking about future income versus past income. Because when you're thinking about retiring, you're looking ahead and at what it's going to cost you in the future to live. But when you're talking about Medicare and your initial Medicare Part B premium and your Part D drug premium, it's based in part on what you made 2 years ago. So for someone retiring in 2014, they look at your income tax statement from 2012. And this gentleman had been very successful in his career. But again, he didn't call Medicare right away. He had already handed in his notice. He potentially could have delayed his retirement, but he'd already handed in his notice, planned his retirement before he called me, and he hadn't yet called Medicare. So what he found out when it was too late was that he was going to have to pay the max for Medicare. Start with Medicare Part B. I know you can't read that. It's just kind of up there as an example. This is a chart that is available at Medicare.gov. Your Part B premium is based on your income from 2 years ago. Most people at the lower end, say a single person, if you earned less than $85,000 in 2012, you'd pay the lowest Part B premium, which was $104.90 in 2014. But there are 5 categories of cost for Part B, and at the very upper end, for the people who were most successful, it's 3 times that cost. So this gentleman had made more than $214,000 2 years ago, so he had to pay $335.70 for his Medicare Part B premium, triple what most people were paying. And that's before the cost of any Medicare supplement or Medicare Advantage or Medicare drug plan costs. So he was a very unhappy camper. And the cautionary tale there is if he would have talked to Medicare before he retired, he might have been able to adjust his retirement date so that different income numbers were looked at when he retired. Maybe he could, maybe he couldn't, but at least he would have had the chance to think about it and plan ahead. And it also affects the Part D premium, not just the Part B premium. So Part D drug coverage includes a surcharge, again, at those same income levels for people that were successful. So when you retire, if you made below the lowest limits, then you're going to pay the advertised price for that Part D drug plan. But if you were more successful, like this guy made more than $214,000, his premium was an additional, above the advertised price, an additional premium of $70 per month for the drug plan. Okay? So really, really important to plan ahead before you retire. And now I'm going to go to point number 3. Pitfall number 3 is thinking that you're always going to be as healthy as you are today. I hear it every single day from people. I am really, really healthy. I never go to the doctor. I don't need much for insurance. Well, I'll tell you right now, insurance isn't about yesterday, insurance isn't about today, insurance is about tomorrow. Insurance is about planning for the unexpected. And as an example, for this one, I'm actually going to use my dad. And the point of this whole thing is healthful living. So I'm going to wrap it around to an end result of healthful living, which will tie into some of the things you heard about earlier today. So my dad was Social Security disabled in his 50s. He's had 4 hip replacements because of arthritis. So when he was younger, he had a lot of health claims. But later, he started really taking care of himself. He, even though he loves red meat and salt, he learned to throw a salad into his diet. Even though he can't do real aggressive exercise, he walks a lot. He watches his weight. He's really careful. So from the age of 65 to the age of 72, He had no claims other than his annual checkups and his regular prescription medications for asthma and for his blood thinners because of the hip replacement. So he was very, very healthy for 7 years. And quite frankly, I think he got a little cocky because in the span of just over 1 year, he got an infection that settled into his hip. It was just a strep infection, but it settled into his hip that had been replaced 3 times. Ended up in the hospital, having been taken to the emergency room by ambulance, was in for 10 days, had surgery, incurred well over $100,000 worth of claims, and will be on penicillin and medication for the rest of his life now because of the infection. Okay, no control over that. It was something he could have gone in for earlier, but still, it was something unexpected. Then, a little bit after that, he was at an event. He was actually at a racing event. And he fell and hurt his hip and had to be taken to the emergency room by ambulance. Okay, again, totally unexpected. He was fine at the end of it, but it was a cost he incurred. Then a little bit later than that, he got in a car accident. And the car accident was not serious, but what he kept saying to me was, I didn't see her. I didn't see the car. So that got me thinking, what's going on with his vision? Sure enough, he had to have 3 cataract surgeries. And now he's waiting for his new glasses because he has prisms or something. I don't know all the details, but I do know that within the space of, like I said, a little over a year, he had well over $100,000 worth of claims, every single one of which was unexpected. So, like the first lady I talked about, the 64-year-old who is sitting uninsured right now, she's taking a very dangerous chance because of the unexpected things that can happen, and it's something I would encourage no one to do when you're looking forward and planning forward. And the thing I want to end on 2 points, because I think I'm down to my last minute. One is a scary point of fact, okay? The Medicare Part B program is fine, the Medicare Part D program is fine, but the Medicare Part A trust fund is only solvent through 2030. So if nothing changes and everything stays as it is right now and claims are as they're expected to be, there will be no more money to pay Medicare Part A hospital claims in the year 2030. So as a country, we need to focus on making improvements to the Medicare system so that that doesn't happen and we extend the solvency of the program. Nobody wants to talk about it. It's very unpopular politically, but it's something we really have to do or it's going to be a very dire situation that will affect every one of us in this room because we, we'll be retired by then, hopefully, and living the easy life. And the last thing that I wanted to end on was the point about healthful living. The only real good way to keep down the cost of health insurance. One of the things I'll say about the PPACA healthcare law is it's spent an awful lot of time talking about what insurance has to cover and how insurance premiums get paid, and it did very, very little to focus on health care and the need to have appropriate and cost-effective health care and to live a healthful life to try to extend the quality of the life that you're going to have as we get older and as we retire. So that's where I'm going to leave you. I was really proud of my dad. He made a lot of changes in his life during that 7-year period because of watching his diet, exercising, and living a healthful life. So that's where I'm going to leave you today. I want to thank you for your time, and I appreciate being here.